these days, the acute admission wards in most of the metropolitan hospitals in Australia are dominated by young guys under the age of 30 with combination psychotic disorders and drug and alcohol problems.
Dual diagnosis is a term which is used to indicate that there are people out there with psychotic disorder who actually use alcohol and substances.
People quite frequently may have depression and schizophrenia, for instance, so I suppose you could have that. But you also have people who have mental illness and intellectual disability, or mental illness and brain damage.
There is some violence from people with mental illness. It's not as common as anywhere near as common as most people would believe, and often it's more often commonly associated with a dual diagnosis, that is a drug and alcohol problem as well as a mental illness, and as well as not receiving regular treatment.
The greatest issue is this drug and alcohol, the mental illness and drug and alcohol addiction. That form of dual diagnosis is what is making it almost impossible for our society's shelters to operate effectively. And this becomes a huge issue because you're not dealing with only one problem, and the two things exacerbate each other.
We used to think that marijuana was fairly innocuous, but now we know that in fact it can cause psychotic conditions in those who weren't genetically underpinned to develop psychosis. And there are a number of other drugs, particularly the stimulant drugs, where we've long recognised the association with psychosis. A number of the other drugs and alcohol will increase your chance of anxiety and of depression. Conversely, there are some people with mood disorders that will use drugs and alcohol to address the mood disorder, sometimes with benefit, but with a great majority without any real benefit, and often setting up a secondary problem that can then become bigger than the original problem.
Mental health systems often will not deal with people with dual diagnosis because they want them to be clean, be off drugs and to be sober before they'll deal with them and prescribe antipsychotic medications, for instance. And the drug and alcohol centres don't want them because they're on medication. So they say, well, we don't want to deal with you because you're taking drugs, antipsychotic drugs. So we can't help you until your mental illness is stabilised. So they get shuttled like it's like a ping-pong effect from one service to the other. They fall between the cracks and many of them die on the streets. The key to it is an integrated approach. Obviously, if the two systems can't work with each other, you need to have an approach which will deal with both the mental illness and the substance abuse at the same time.
And of course, Sir Winston Churchill's, his medication was a bottle of Johnny Walker, and that's the worst thing he could have done. So the great man must have had a tremendous resilience to be able to overcome both the depression and the alcohol abuse that went along with it.
Once you've got some progress toward dealing with the addiction, you can really deal with the mental illness at the same time.
If you've got a drug-induced psychosis, usually the fumes settle down in a few days and a person's back to their normal unpleasant self or pleasant self, and you can sort of discharge them from hospital.
It's always been an issue, but with the greater use of illicit drugs in the community, then there's no doubt that this has changed the profiles of psychiatric condition.